This is a calf or gastroc stretch. Ideally, you get a board. Actually, bring that leg back first. Ideally, you get a slant board. These can be purchased on Amazon. And I would do both at the same time, just for sake of time. Make sure your feet are straight and the heels are down. And I personally like to do this barefoot, but you can go with shoes too. You're gonna hold that for a minute, and then after a minute's up, then you can step over. This just deepens the stretch. So you're trying to get to the ground, but only go as far as you can with that right heel, that back heel staying down, and knees straight. After a minute of that, then you can switch to the other side. This is heel raises 3-way. So I usually do sets of 10, just for video purpose, we'll probably just do 5. So it's up, pause, down slowly. That's with feet straight. And then you can do feet in E version. So same thing. It's up, pause, down, slow. And this just hits different angles of the gastroc. All right, and then do feet inward. So I usually do 10 of each. This is what we call a couch stretch for hip flexors and quads. I like to do this initially with an incline bench set the way it is here, depending on how stiff you are. Go ahead and bend over first. If you just try to muscle up, you'll have a hamstring cramp. So you get your knee in the crevice, shin against the backrest, upright, just like he is. You can always make it a little harder or a little more intense by squeezing the glute and pushing your hip forward. All right, and then when you want to go to the next step, bring the backrest up. And all these stretches are 1-minute holds, by the way. So same thing, hands down first, knee in crevice, shin against backrest, stand tall. Good. Once that gets pretty easy, then you can progress to doing it against the wall. So we're going to head over here. Put down a little foam pad to be nice to your knee. You get down low, yep. Knee in the crevice, shin against the wall. All right. And that's the ideal position. You might want to grab something like that stool to support yourself if you're having trouble getting up there. And same thing, 1-minute holds. This is terminal knee extension, and this is to work the end range of full extension of the knee, where the quad tends to be a little weak, especially post-op. So line your feet up, attach a thick band above the knee, keep the left leg straight, bend the right knee, keeping the heel down if you can, extend backwards. A little 3-second pause right there, relax it slowly, and continue. These are staggered squats, so put 1 foot back and one foot out, and do squats like this. Ideally no hands like he's doing. If you can't do it with no hands, you can do hands on the way up and then no hands on the way down. All right, and then you would switch sides. Okay, and you can progress it by putting something underneath the foot that's back that just increases the knee flexion and therefore the demand on that quad. And then after that, you would switch. This is what I like to call the seated box drill. This is for the quads and hamstrings. So you sit on something with so your feet are in the air and put a heavy band, a loop band around your ankles. And I keep one leg back and extend the other one out. All right, so normally I do sets of something like 20 or so. What we're doing here is his left hamstring is doing an isometric contraction and his right quad is doing a concentric and eccentric contraction. All right, and then you switch to the other side. So you match whatever you did on the other side. All right, and then the next phase of this would be legs out into full extension. So now you're doing an isometric quad contraction on the left and a hamstring contraction on the right. And same thing, match the sets to whatever you did, the reps to whatever you did in the first round. This is the hamstring lockout. Get a thicker band, put it around your ankle, put your femur right up in the air, block it with your one hand, and with the other, pull the band. So it's kind of a push-pull You're trying to lock that hamstring out at the end range. It's kind of like an active stretch. And I usually go 20 to 30 reps on this. This is hip abduction, and this has to be done exactly right or you don't really target the muscle you're going for. This is the intent here is to strengthen the glute medius and minimus, which are hip abductors. There is a group of muscles, or there is a muscle called the TFL, which connects to your IT band, which can kind of take over and do a little more work. That's usually the source of IT band pain. So we're trying to avoid that. So basically make that top leg straight and lift up. You don't want to go too high, that's good. If you go too high and your pelvis starts to tip towards your back, you're using a muscle in your back called your QL. So limit the range of motion. Turn the foot down ever so slightly. That's it. That puts the TFL a little bit of a disadvantage and helps target the glute. So the way you set up is, this has to be a straight line between your shoulder, your hip, and your ankle. So let's get that foot back a little further. If anything, you want to bias back even more so. Now lift up. That's the line you want to be in.